Guaifenesin, found in Siltussin SA, is used to treat coughs and congestion caused by the common cold, bronchitis, and other breathing illnesses. It works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. If you are considering using this medication, it is important to read the package instructions carefully before you start. Siltussin SA is not recommended for use in children younger than 12 years, and cough and cold products have not been shown to be safe or effective in children younger than 6 years. It's important to follow all dosage directions to decrease the risk of side effects, and to not give other cough and cold medications that might contain the same or similar ingredients. Siltussin SA does not cure or shorten the length of the common cold, so it's important to talk to your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids or using a humidifier. When taking Siltussin SA, you can take it with or without food, as directed by your doctor, usually every 4 hours. If you are self-treating, make sure to follow all the directions on the product package. If you have any questions, ask your doctor or pharmacist for guidance. Guaifenesin may have a bitter taste, so do not split the tablets unless they have a score line and your doctor or pharmacist tells you to do so. Swallow the whole or split tablet without crushing or chewing. If you are using the liquid form of this medication, make sure to carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. For powder packets, empty the entire contents of the packet onto your tongue and swallow. To prevent a bitter taste, do not chew. The dosage of Siltussin SA is based on your age, medical condition, and response to treatment. Do not take more than 6 doses in a day. Do not increase your dose or take this drug more often than directed. It is important to drink plenty of fluids while taking this medication. Fluids will help to break up mucus and clear congestion. If your cough is accompanied by a headache that doesn't go away, fever, severe sore throat, rash, or if it lasts, returns, or gets worse after 7 days, make sure to tell your doctor. These may be signs of a serious medical problem. Get medical help right away if you think you may have a serious medical problem. If you experience nausea or vomiting, make sure to consult your doctor or pharmacist. It's important to note that your doctor has determined that the benefits of using this medication outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. While it is rare, a severe allergic reaction to this drug can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or difficulty breathing. Keep in mind that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. As for the daily dosage and optimal timing of taking this medication, follow the instructions provided by your healthcare provider. If you have any concerns or questions about the dosage or timing, make sure to discuss them with your doctor or pharmacist. Before taking Siltussin SA, make sure to inform your doctor or pharmacist about any allergies you may have and any inactive ingredients this product may contain. It's also important to discuss your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, diabetes, liver disease, or phenylketonuria, PKU. If you are pregnant or breastfeeding, it's important to talk to your doctor about the risks and benefits of using this medication. Additionally, if you are scheduled for surgery, make sure to inform your doctor or dentist about all the products you are using, including Siltussin SA. Always consult your doctor or pharmacist before using this product to ensure it is safe for you. When taking Siltussin SA, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, guaifenesin, the active ingredient in Siltussin SA, is found in both prescription and non-prescription products. Make sure to check the labels of all your medications to avoid taking more than one product containing guaifenesin. It's also important to note that this medication may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are taking Siltussin SA. If someone has taken too much Siltussin SA and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. If your doctor has prescribed Siltussin SA for you, it's important not to share it with others. Make sure to attend all scheduled medical and lab appointments while taking this medication. It's important to note that Siltussin SA is meant for temporary use only. Do not take this medication for more than 7 days unless specifically directed by your doctor. If your symptoms persist for longer than 7 days, be sure to inform your doctor. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and take the next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Siltussin SA, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom, and do not freeze the liquid forms of this medication. Different brands may have different storage needs, so it's best to check the product package for instructions or ask your pharmacist for guidance. And remember to always keep all medications out of reach of children and pets. When you no longer need the medication or it has expired, it's important to properly discard it. Instead of flushing it down the toilet or pouring it into a drain, consult your pharmacist or local waste disposal company for the best way to get rid of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.